Good afternoon, everybody. Thank you for joining us today. I'm still admitting some people in from the lobby, so I'll just wait a couple minutes until I can keep admitting folks in. It may take me a moment to keep admitting people who are joining. So if you'll just give me a couple moments to make sure that I've got everybody admitted. Thank you for being here with us this afternoon.
I can also keep an eye on the lobby once you start, Emily, and I can admit people in too.
Great, thanks, Candace.
Mhm.
All right. We will go ahead and get started. So thank you everybody for being with us today for our advocating for individuals with dementia and their caregivers. My name is Emily Peterson. I'm the Advocacy and Policy Manager for Milwaukee County Aging and Disabilities Services. I'm joined here by some of my colleagues at Milwaukee County Aging and Disabilities Services. So we'll go ahead and introduce ourselves. I'll turn it over to Kayla because she's unmuted, and I'll have her introduce herself first.
All right. Good afternoon, all. My name is Kayla Steinke, and I am a caregiver support coordinator with Milwaukee County Aging and Disability Services. We are so glad to have you here today and to see you interested in this topic. Caregiving is a huge part of our advocacy and work here. So thank you for being here today.
And then Christina, if you want to introduce yourself.
Yes, good afternoon, everyone. My name is Cristina Huitron, bilingual dementia care specialist for the Milwaukee County Aging and Disabilities Services. Thank you for joining us today.
And then Candace.
My name is Candace. I'm also a dementia care specialist with Milwaukee County Aging and Disability Resource Center.
Thank you. The run of show for today's event, we're going to hear from our guest speaker, Senator. We'll be covering some information about the Wisconsin State Dementia Plan, some information on upcoming state and federal legislative issues, opportunities to advocate, and then some programs and services offered by Milwaukee County that you may be able to take advantage of. So I'll go ahead and get started with the introduction of our special guest today, State Senator LaTanya Johnson. Elected to Wisconsin's 6th Senate District in 2016, LaTanya Johnson previously served in Wisconsin's 17th Assembly District since 2012. The 6th District includes residential, urban, and downtown Milwaukee, as well as the southeast part of Wauwatosa. Senator Johnson has lived in Milwaukee for over 35 years. She holds a bachelor's degree in criminal justice from Tennessee State University. Before being elected to public office, LaTanya owned and operated a licensed in-home child care service. She served as president of AFSCME Local 502, the union representing in-home child care providers in Milwaukee. She went through Emerge Wisconsin, an intensive training program for progressive women who want to run for office, and is a proud alum of the class of 2012. Senator LaTanya Johnson serves as the ranking Democratic member of the Budget Writing Joint Committee on Finance, as well as several other commissions and councils related to public safety, democracy, and healthcare. So we're incredibly excited to have the senator joining us. It might take me a moment to figure out how to give her permission to share, but I think I know how to do it. So just give us a second. This is our first time using the Teams webinar function. Okay, I think I see her on there and we can see her. So I'm going to pin her and spotlight her for everyone. And then we'll turn it over to the senator. All right. The floor is yours, Senator Johnson.
Thank you. And thank you all for giving me this opportunity. It's truly a privilege to be here to welcome all of you on this day of advocacy. As you can see, I was having a few technical problems and my staff was amazing. That was Jacob Taylor that was in the screenshot. He's my tech guy, AKA, because I don't know nothing about technology, so Jesus help us all. Um, as some of you may know, I am the ranking Democratic member of the Joint Finance Committee. And this past summer, the legislature passed this 2025-2027 state budget. So I wanted to open up my remarks to give you an update on how the process will impact individuals with dementia and their caregivers. Now, I won't lie, it's been a tough fight, and we weren't able to secure everything that we wanted and needed for long-term health. Still, there were some major steps forward. Republicans didn't have the votes to pass the budget alone, and with the help of the state Senate Minority Leader Diane Hasselbein, we did secure some concessions. And as much as we would have liked to done significantly more, there are some pieces to this budget that I'm super just excited for and happy that we were able to secure, including a 3.7 million all funds increase for aging and disability resource centers to strengthen our counties. Like Milwaukee's capacity for dementia service, caregiver navigation, transportation access, and home care support. The budget also protected Medicaid rate increases for personal care home health and private duty nursing by increasing reimbursement levels that help stabilize the in-home workforce supporting people with dementia. We retained $2 million in one-time funding for the Wisconsin Caregivers Careers Program. That's keeping free CNA training and retention bonuses available at a moment when long-term health workforce is in crisis. We also achieved a statewide minimum payment rate for family care residential providers, ensuring a stronger wage floor for assisted living and group home workers, including those who care for adults with dementia. But while these were all important investments, it's hard not to feel like we left a lot on the table. For starters, my colleagues removed the governor's proposed 1 million increase for Alzheimer's family and caregiver support program, which would have expanded county dementia care funding. They also chose not to include the $400,000 expansion of respite care grants, blocking additional opportunities for families and caregivers receiving temporary relief. Republicans cut the entire $9.2 million adult protective services package, including $7.7 million for counties' APS units and $1.5 million for DHS oversight of assisted living safety meant to protect older adults from abuse. The proposed $21.7 million investment in home delivered senior meals was also eliminated, shelving a major effort to support older adults with dementia who rely on daily nutrition services. The governor's 15 million complex patient transitions pilot was rejected, as well as delaying urgently needed solutions for hospitals seeking safe placement for dementia patients and complex medical needs. The legislature further reduced the governor's $8.7 million Wisconsin Caregivers careers expansion to a one-time $2 million gift, limiting the scale of CNA recruitment needed to meet statewide dementia care demands. Clearly, there is more work to be done, and that is why you all are here today to advocate for these much needed initiatives and to tell your stories and to make us hear those stories. So I know that this fight is very near and dear to my heart, but so many other people's hearts in this building as well. I cared for my grandparents, both having dementia, my grandmother having Alzheimer's, and I can remember the coordination it took to try and keep her in the home. You would think that something that would be a cost saving measure for the state wouldn't be so difficult for people just trying to do the right thing by their elderly family members. I can remember coordinating with my aunts for my grandmother. My grandfather, when he died with dementia in 2005. My grandmother was his caregiver. But I noticed at the funeral that my grandmother was having a lot of problems with memory herself, as well as some confusion. Um, After the funeral, we took my grandmother to the doctor and realized that she was experiencing Alzheimer's as well. By the time I intervened with my grandmother and got her to a doctor, she had lost significant amount of weight. My aunt lived upstairs. We were doing everything that a family possibly could do to make sure she was okay. We were making her meals, leaving them for her, but what we didn't realize was that at the state of Alzheimer's she was in, she was forgetting to eat. So we had to restructure her care to make sure that she had care 24 hours a day. So not only was my aunt living upstairs, my other aunt moved next door to her, and I lived 8 blocks away. And between the three of us, we were able to keep my grandmother in the home. Now, for my grandmother, the caregiving piece was extremely, extremely strenuous on our family. There were days sometimes I would come over and there was a stranger sitting in the living room and she's just having a conversation, which could be extremely dangerous for her safety and her security. But it was made even more difficult because my grandmother only qualified for Medicare. She didn't qualify for Medicaid, which meant that any caregiving services that we wanted provided, if it didn't come from the family, we had to pay out of pocket. And for so many of our struggling families, that becomes an even bigger hindrance in making sure that their family members get the care that not only they deserve, but the care that they need. Now, my mom just moved to Wisconsin from Tennessee in July, and I am a caregiver once again. And when I say that I wish that the system had improved, my grandmother died in 2012. So I was thinking, oh, the system is so much further along. In terms of care, yes, my mom is receiving, I can't complain about the care that she's receiving. But in terms of the process, a lot of what should have been changed, there are still hurdles for a lot of our family members. Um, my mom, she's able to do a lot of things for herself, but I can see early onset of Alzheimer's forming for her just from my experience from my grandmother and my grandfather. And that scares me because this job isn't a typical 9 to 5. I know that when my mom can no longer provide care for herself or safely get herself out of the house in an emergency, then we're going to have to make other arrangements. But for so many of our caregivers, these stories are what this building needs to hear. I often tell people that as an elected official, you meet so many people, and you may be really, really good with recognizing faces, but sometimes those names are a little bit difficult to come by. But even if we don't remember your name, the one thing we always will remember is your story. Because the people in this building, they're just regular, everyday folks. But it's those stories, it's your experience that's going to help us to realize exactly what those issues are. And it's going to help make your advocacy. It's going to help to make that difference. Nobody has the expertise that you do when it comes to providing the services and the resources that you provide and helping those families navigate where they need to get to. And for so many of these families, they feel all by themselves. They're overwhelmed. Not only are they caring for the people that they love, but they're also trying to remember to care for themselves. And that can become extremely, extremely difficult, especially in some of the situations that we're in today, where even just making sure that people have the food and the resources that they need to survive is increasingly difficult. So, with that being said, thank you for this opportunity. I just wanted to let you know that not only do I hear you when you talk about the gaps in the system, but I personally understand that because I'm living that reality right now. as so many people are. You know, one day you wake up, everything is perfectly fine, and then the next day you find yourself having to become a caregiver for some of the most important people in your life. And everybody deserves that dignity, especially in their older age, especially when they've invested so much in us. So that's why gathering on these days and standing together is so important, because when we stand together, we speak with one voice and one purpose. And we're impossible to ignore when that happens. And it just helps to strengthen the system. Even if we don't see these changes right away today for ourselves, family members who continue to enter this process every single day will feel the advocacy that you guys made today further down the road, because it'll be because of you that these changes are made. So thank you for having me here, and thank you for the invite. I truly, truly appreciate this opportunity.
Thank you so much, Senator Johnson. We really appreciate having you here today and for all of the advice and information you shared with our advocates. We'll give a virtual round of applause.
Thank you.
Thank you. Okay. So Kayla is going to share a short PowerPoint that we've put together to get us through the remainder of our program. And once again, thank you so much to Senator Johnson for joining us. She has a lot of great information to share about policy, but of course, the wisdom she provides from her own personal experience is so valuable and a great blueprint for how we'll move forward through the rest of our event. So I'll turn it over to Kayla now, who will share some information about the Wisconsin State Dementia Plan.
Thank you, Emily, and I echo your gratitude to Senator Johnson. What a fantastic way to kind of frame the work we're doing today. So, as a next piece of our agenda, I'm going to present on the Wisconsin State Dementia Plan. And I am doing this so that you have some context about the current work happening in Wisconsin to support individuals living with Alzheimer's and dementia, as well as their caregivers. The Wisconsin State Dementia Plan is really a unique and exciting way that the state of Wisconsin has worked to address dementia and Alzheimer's at a state level. The state dementia plan was made possible by advocates and people like Senator Johnson, but also family caregivers and those living with Alzheimer's and dementia across the state of Wisconsin. And just a quick summary of the Wisconsin State Dementia Plan. So we always are operating under a state dementia plan. They are 5-year plans, with the first one having been developed in 2014. And the plan was developed in 2014 based on the strain that Alzheimer's and dementia was causing to the residents of the state of Wisconsin, as well as our long-term care and health systems. We wanted to build a unified and strong response as a state to address those strains. And so, really, to summarize what this state dementia plan is, it's basically a roadmap for Wisconsin to improve the quality of life for those who are living with Alzheimer's and dementia or those who are caring for them. And also at the same time to minimize the public and private costs for our residents and our system. The state dementia plan is really unique and exciting in that it pulls in all parts of our state. So it pulls in residents, our private residents, but also medical, social, crisis, protective systems, and other provider networks. So it's really a unifying plan. And I'll kind of start by summarizing accomplishments from our past plan. So we are currently in a plan that will span 2024 to 2028, but I want to highlight some of the great things that came out of our last plan. And I'll pinpoint a few of them. One is that because of the advocacy work done in our previous state dementia plan, we now have dementia care specialists who are serving in all counties and tribal nations. Christina and Candace are dementia care specialists, and you'll learn more about that program later, but what an asset to have across the state. Other things that we were able to successfully accomplish in the previous plan, Senator Johnson mentioned WIS Caregiver Careers Program. So that is a program that expands the direct care workforce. It helps train up people who can provide care in facilities or in homes. And another exciting thing that came out of it was increases to the amount of funding available for giving caregivers financial support to be able to pay for respite. So to be able to pay to have a break, we were able to increase the amounts available for that and much more. But those are just some highlights of what we accomplished in the last plan. Our current plan is the 2024 to 2028 state plan. It builds on the successes of our previous plans. And importantly, it's informed by the community. So we held 49 community conversations across the state and also had a survey that was sent out to professionals and providers and also all residents who are engaged with Alzheimer's and dementia in a personal level. And that informed the creation of our new plan. Our plan is based in these kind of broad categories. So that includes advocacy work, data and research, professional how to educate the community about Alzheimer's and dementia, and also how to coordinate care across our various systems to support people living with Alzheimer's and dementia and their caregivers. And very importantly, this year or this plan, we added a community advisory board. So in the coming year, there will be a recruitment strategy to get citizens who are living with Alzheimer's and dementia or their caregivers to join this community advisory board and inform the progress and work that gets done through our state dementia plan. I will put the link in the chat so that you can have access to the full document that outlines the different goals and efforts that will be incorporated into the current state dementia plan. It will also allow you to look at the previous plans. And it can give you an opportunity to sign on if you want to stay informed of updates and opportunities that will arise for participation. As we mentioned, this is a statewide plan, and it's only successful if we have buy-in from both the kind of public sector and the professional sector, as well as most importantly, the residents of the state of Wisconsin. So I will share that in the chat and look forward to your continued engagement with the state dementia plan.
We'll now turn to talking a little bit more about public policy at the state and federal level impacting individuals living with dementia and their caregivers. And as a note, we have a couple links throughout the presentation that provide some more information on this. There was some with the state dementia plan. So we will share the slides after this presentation. We'll send them to everybody registered so that you can click on the links and learn more, and also sign up at that link that Kayla shared. So I'm going to start with some state legislative updates. If you have any questions as I go through the slides, you're more than welcome to put information in the chat or the Q&A. And we'll also save time at the end of the presentation for additional questions you may want to ask. So one legislative update that we're really excited about is 2025 Wisconsin Act 21, which was a bipartisan piece of legislation that expanded eligibility for the Alzheimer's Family and Caregiver Support Program, which is a statewide program operated at the local level that provides funding for goods and services to families who are supporting an individual with a diagnosis for Alzheimer's or other types of dementia. We operate this program here at Milwaukee County Aging. I believe Kayla will speak a little bit more to how this program works later on in the presentation. Previously, this program had some income limits to it, and we worked with legislators at the state level to remove those income limits so that this program could be accessed by more individuals. And there were some regulatory reasons for seeking this change, but Importantly, as we all know, Alzheimer's affects people regardless of their income level. And so having the ability to access this program by more individuals and families was crucially important. And we were really glad to see this bill move forward and then signed by the governor a little bit earlier this year. So now it is in effect. The next piece of budding legislation that I wanted to highlight was this idea of memory care designation legislation. So this is some upcoming work by the Alzheimer's Association of Wisconsin to create truth in advertising legislation. The idea is that this would provide standards for when and how community-based residential facilities could advertise themselves as a memory care facility. As it is under current law, a community-based residential facility, which is a nursing home or any other type of facility in the community, can currently call themselves a memory care facility without any regulation. This bill, once drafted, would provide some standards for which types of facilities could actually be considered a memory care facility. There are 37 states right now in the country that have types of legislation like this. Under this proposed legislation, facilities that want to be called a memory care facility would need to have dementia-specific training for staff so that they do know best practices for working with individuals with dementia. They would have to have a safe, dementia-capable physical environment at their facility and a care program tailored to the needs of dementia patients. So again, this is proposed legislation to instill these standards in facilities that want to be called a memory care facility. Right now, there are no standards for facilities that want to be called a memory care facility, which presents challenges for people who want to make sure their loved ones are taken care of when they're in an institutional setting. Another piece of interesting legislation that we are considering at a statewide level is the idea of a caretaker driver's license designation. One state that has implemented this is Minnesota. And it's the idea that you can create a record at your DMV account that states you're a caretaker for somebody else. So, for example, if I was caring for my grandma or my mother and they had dementia or Alzheimer's, I could have that recorded on my driving record so that if there were an emergency and I was in the hospital or something like that, when an emergency personnel would pull up my driver's record, it would show that I'm caring for my mom. This is her contact information, and they could get in contact with that person to let them know that I might not be there for a while. So this is to protect the care person, so that they are made aware of any situations where the caretaker is going to be away for a while. So these are a couple of different pieces of state level legislation that are impacting individuals with dementia and their caregivers. There was also some interest in increasing dementia crisis stabilization units, program specialist positions, and innovation grant programs at the state level through the state budget that the governor introduced. They did not make it into the final budget, but there is still interest in making sure these statewide resources are available at the local level in the future. So keeping an eye on those as they move forward. And then at the federal level, there are a couple different opportunities to impact legislation for individuals with dementia and their caregivers. One of these is the Credit for Caring Act. This is not necessarily specific to individuals with dementia or caregivers, but for caregivers overall. This is a piece of legislation that AARP has been working on with the Alzheimer's Association. And as many of you probably know, caregivers are providing billions of dollars of care that is unpaid for their individuals that they love every single year. And I did read that on average, caregivers spend over $12,000 out of pocket on costs for those that they care for. So whether that's buying medical supplies, food, and other things to take care of people, it's all coming out of pocket with no opportunity to reimburse those costs through health insurance or other methods. So what the Credit for Caring Act would do is it would provide a non-refundable federal tax credit of up to $5,000 for family caregivers for those eligible care expenses. This would be available to anybody who makes more than $7,500 a year, and they could get that as a tax credit. So this is a bipartisan bill that's currently working its way through Congress, and an opportunity to provide some relief to those who are doing unpaid care work. The BOLD Act, the Building Our Largest Dementia Infrastructure for Alzheimer's Act. Some of these get so wordy, but commonly called the BOLD Act, was just recently reauthorized by Congress, which is great news. And it provides funding to state and local public health departments so they can implement Alzheimer's interventions and provide some reporting back about how those interventions are performing. The Accelerating Access to Dementia and Alzheimer's Provider Training Act seeks to implement better training to providers who are making assessments for people who think have Alzheimer's. So this is more of a way to get medical providers better training on making diagnoses. And then a couple other items I just did want to highlight. One is that the Older Americans Act provides national family caregiver support funds to provide support to caregivers, regardless if it's an individual with dementia or just somebody else caring for somebody. This is something that we're also tracking to make sure that there's funding to support those initiatives and for other programs for older adults like meal programs, transportation, other supports that any older adult could take advantage of. And there's a lot of overlap in those populations. And then finally, of course, we're always making sure that the federal appropriations process, aka the federal budget, is continuing to move along, which has been at risk recently. I'm sure people are familiar with this, but it's really crucial that the federal budget continue to be funded and move along every single year, because without that, a lot of these other initiatives, such as, funding for dementia initiatives through the Federal Department of Health Services, through the CDC, those initiatives cannot continue unless the federal government continues to operate. And then finally, if advocacy and public policy is something that you are interested in and passionate about, which I'm assuming is a lot of people here because you signed up, there are opportunities to get involved in this work. And I first want to say that I think Senator Johnson provided a great roadmap for how this is important, why this is important, and how you can do it. And I just want to say your story is the most important thing that you can share with legislators. And as the senator shared, those stories are the most memorable thing for legislators and really impacts policy and drives policy. So you can know facts and figures, statistics, you can know about laws and legislation, but your personal story of caregiving is going to be the thing that they remember and what is truly going to change how policy outcomes are derived. And I think the story that Senator Johnson shared about caring for her grandparents and her mother is probably what's going to stick with most people after this webinar. And it is definitely going to be what sticks with me. I've heard her talk about her family members before when I've met with her, and it's definitely in my memory, and I know has really impacted the way she governs and how other legislators govern at the state and federal level. So please definitely know that your story is the most important thing that you can share. And the most important thing that you can continue to kind of hone and work on telling for others. But practically, some methods that you can think about for the future is the Wisconsin Alzheimer's Association hosts an advocacy day every single year where you can get together with other advocates who are passionate about this topic. It's February 3rd, 2026, crazy to think about, in Madison, Wisconsin. The way the event works is we'll get together in the morning, talk a little bit more about the upcoming public policy topics, and then you'll go to the Capitol building across the street, meet with your legislator, and share your story. So I definitely encourage that. It's a great way if you've never talked with legislators before or done an advocacy event. They make it super simple and easy to participate. Similarly, the Wisconsin Aging Advocacy Network hosts advocacy events. They do an annual advocacy day and local advocacy events. So I encourage you to seek those out as well. They are not specific, though, to Alzheimer's or dementia-related diseases. They're more broadly about older adult issues, but still maybe something you're interested in. And then again, be in regular communication with your state and federal legislators whenever you can, and keep sharing your story, whether you're calling or emailing them, if that's easiest for you, whether you're engaging with them on social media. Many of them have Facebook pages or newsletters you can follow. And then a lot of them hold office hours in the community. If you're able to get in front of them that way, you don't have to be in their office in Madison. If you can get in district with them, that's a great way to participate. And then finally, engaging with regional and local aging advocacy groups is another way to elevate issues that are important to caregivers in any way. We have a Milwaukee County Commission on Aging with an advocacy committee where we definitely welcome your participation. But maybe you live in a city that has a local Commission on Aging. For example, Wauwatosa has a Commission on Aging, and there are other municipalities with their own advocacy groups that are interested in these types of topics. So if that's something you're more interested in engaging on, I definitely encourage you to do that. And now Candace will talk a little bit more about our Dementia Care Specialist program.
Thanks, Emily. So I'm going to talk first about the Dementia Care Specialist Program in general. So these are the things that guide our work throughout the state as dementia care specialists. So like mentioned before, we are in every single aging and disability resource center in every county throughout the entire state of Wisconsin, as well as local tribes. So these are the three things that kind of guide our work as dementia care specialists. So the first one is to make sure our internal staff within the aging and disability resource centers are dementia capable. So making sure that our own staff are dementia friendly. They know about the resources and the things to support caregivers and people living with dementia. The second one is to act as a catalyst to create dementia-friendly communities, to sit on committees to help move this work forward, be engaged with other organizations and other businesses that are passionate about this work. So to be that advocate to help promote supporting people with dementia and their caregivers. And of course, the last one, which is the most important one to me and other DCSs too, is to support the individuals. So the actual people living in the community with dementia diagnoses and their family caregivers to help be that person to support them in what they need to continue to live in the community. A lot of people, that is their greatest wish, is to stay at home for as long as they can, as safe as they can. And that's part of our role as DCSs, is to help make that happen. Next slide, please. So every single dementia care specialist can choose different types of programs to offer in their community. A lot of us offer the same things, but sometimes our work is a little bit different. Mainly though, same thing across all dementia care specialists is we all do consultations with families, so that one-on-one work with individuals and families living in our communities. We are kind of governed within like our county. So, you might want to work with me, but maybe you live in like Washington County, but that's okay. There's another wonderful dementia care specialist I can connect you to in Washington County. We also all do community memory screens. That's a basic screen to detect for early signs of memory loss. Very short, simple screen. Some of us do dementia caregiver support groups. A lot of us do DICE training, Savvy Caregiver, which is a evidence-based program for people living, taking care of somebody living with dementia. So it's for the caregiver. Lots of community presentations across like a wide range of topics like brain health, different types of dementia, behaviors, resources, lots of good presentations that we give. We also have the Dementia Friends program, dementia friendly business training for local businesses in our county that want their staff to be more dementia friendly. So we can provide that free training for businesses. We do the Boost Your Brain and Memory program, which is a dementia kind of prevention program. It's an 8-week program focusing on brain health. We also do time slips. We do virtual dementia tours. And new this year, it's not on this slide, I should put it on here. We do powerful tools for caregivers as well, both in English and in Spanish, which is another evidence-based program for family caregivers. Next slide. And this is just our contact information for the Dementia Care Specialist program in Milwaukee County. So that's our phone number. That is the link to our website that lists all of our programs, more information on what we do. Our email is there as well. And then the QR code actually will sign you up for a quarterly dementia-friendly Milwaukee County newsletter. So I kind of take all of these really cool things that are going on in the state and our county, upcoming programs, new resources, new information and research, and I kind of take it all and I put it in one spot. And I send that out each quarter through email. So if you would like to sign up for that, you can use the QR code there. Otherwise, you can also go to our website, and there is a link there on our website for you to sign up as well. And then I think I'm going to pass it over to Kayla to talk about the Caregiver Support Program.
Yes, thank you, Candace. And I will just plug the newsletter that Candace mentioned. That's a great way to stay updated on advocacy opportunities or ways to get engaged with this work. So, highly recommend following that newsletter. And also, just a reminder that the dementia care specialists are a result of really strong advocacy work. There was tremendous effort put into getting funds budgeted to be able to have them throughout the state of Wisconsin. So a huge success story of what our advocacy work can do. I will quickly add that we also within Milwaukee County Department of Health and Human Services have a caregiver support program. That is the program that I am working with. And, you know, Emily highlighted that there can be financial impact on family caregivers. We know that there can also be emotional, mental, and physical health impact on our family caregivers. So even though we might find great honor and meaning in providing care to someone that we love, it can take a toll on us and it can create some burden for us. So our caregiver support program is really here to help walk alongside family caregivers in Milwaukee County. We do this in a few different ways. Kind of more community level, we do special events and education opportunities to make sure that family caregivers are made aware of the different benefits and resources that can be available to them and also available to the person that they care for. And then on the individual level, we work with families. We come out to do home visits and we will do assessments during those visits to help make sure that our family caregivers and their loved ones are connected to all of the different resources and benefits that could be available to them in their journey. We depend on family caregivers. They are such an important part of our system of care. And because of that, we want to make sure that they have access to all of the supports that can be available to them. And one piece of that support is that we do receive federal and state funding that can be used to provide financial support to family caregivers. And those funds are often used for getting respite or care into the home to give family caregivers a break. We know that often family caregiving is a 24-hour job, and that can be on top of your paying job, as well as maybe the care you provide to children or other loved ones. So we are able to, in some cases, provide financial support that can be used for respite, home modifications, or other goods and services to support the family caregiver and the important work that they do with their loved one. So as the last slide shows, we do have, you can contact us through our email address and our phone number. I will post those in the chat. But please, if you are caring for a loved one, we are here to walk alongside you and support you. You're not alone, and we look forward to connecting with you.
Thank you so much, Kayla. Once again, thank you all for being here today. We wanted to take a moment and provide some space for you all to have an opportunity to maybe share your personal story, your personal success story around advocacy. And sometimes we think about advocacy as being something at the macro level, which definitely is, but we can also provide advocacy at the micro level. That can include maybe at a home visit that you had with a professional, maybe at the clinic, maybe while calling a community partner or anything like that. So we just wanted to take about 5-10 minutes and open the floor for anyone to talk a little bit about your story and successes. So I believe you are able to unmute yourself, so feel free to do that, or you can raise your hand, or you can put something in the chat, and we will be available to read it off. So is there anyone that would like to share their story with us?
Yes, I would like to share. My name is Yolanda Farrell.
Hello,
And
Yolanda. Welcome.
thank you so much. And I just want to thank you guys for everything that you do because I lost my father from dementia in September of 23. And if it wasn't for going to these trainings for dementia, I don't think I would have made it. So it really helped with the step-by-step letting me know what was going to happen at this point and at this point. So I knew what to expect. I can remember relocating to the north where my parents live 3 times and finding a job there in order to assist my mom because she refused to put him in a facility. So she took care of him. So it was very difficult. I was like a zombie going through that whole process. But with the help of, like I said, the dementia staff and all the trainings and all the literature and everything that you guys gave me, it really helped me and it helped my family because we were in total darkness regarding this disease. So I just want to say thank you so much to Kayla and everybody. Thank you so much.
No problem. Thank you so much, Yolanda, for sharing your story. And that's a good reminder of, us having and being open to up-to-date information, reaching out. We are here just a phone call away, an email away, and we can provide you with different education opportunities. Now, is there anyone else that would like to tell us a little bit about your story?
I can. My name is Angie.
Hello, Angie.
I live in Milwaukee County, but my aging parents, who are 78 and 81, live in Waukesha County. And I think the collaboration between Milwaukee County and Waukesha is so important in the surrounding communities because so many of us don't necessarily live near our families anymore. Some are out of state or out of country. And as the oldest of three, a lot of the care duties fall to myself while I'm working and raising my own children. And so the sandwich generation, I think, is really impacted. And again, I just want to stress the importance of the resources that you guys provide. The advocacy is so important. I work on the younger end of healthcare with kids and babies and families. So I do a lot of advocacy that way, but because I'm in this role now as a caregiver for my aging parents, I also see the benefits of working on the other spectrum. So kudos to all of you. So thanks for hosting this.
For sure, no problem. Thank you so much, Angie. We have time maybe for one more person to provide any other story that you would like to share with us today. All right, I don't see anything else coming in through the chat, but I remember Candace, you had a little bit of information around like FMLA and some families that you recently worked with, right? Can you tell us a little bit more, please?
Yeah, I'd love to. So, I've worked with a few family caregivers who were working while they were trying to care for their loved one, and they didn't really understand like how FMLA could protect and benefit them in their work as family caregivers. So, I supported a few caregivers to kind of educate them about like what it is, how it can help them, how it can protect them, and they were able to successfully get FMLA through their work to have some accommodations, like maybe working from home a few days a week so they could look after their loved one. Also being able to maybe take off so they can take their loved one to the doctor. So those have been a few like success stories over the years where People, are kind of like, well, I like my leg's not broken. I don't need to use FMLA, and just kind of educating them how else it's meant to be in place to support people. So that's been an example. Also, too, we do a lot of work with kind of being an advocate for the person kind of through their caregiver for their doctor. So kind of letting them know like how to talk about things with the medical provider caring for themselves or caring for their loved one, pushing for accurate and timely diagnosis, what that looks like, what that process is, how they can best advocate for their own care with their provider too, letting their provider know I'm a family caregiver, and that comes with its own slew of health risks in itself. So making sure you're good and you're healthy so you can be the best version of yourself for the person that you love that you're caring for. So I could probably talk forever about examples, but those are just a few that come to mind.
Perfect. Thank you. Thank you. We really appreciate that. Now it has come time where we have about 8 minutes or so for a Q&A. So if anyone has any questions for myself, Emily, Kayla, Candace, you can definitely put those in the chat, raise your hand, unmute yourself. We are here and we will be able to answer your questions. So let's jump on in. Any questions for us today?
I guess while we're waiting to see if anybody has any questions, I do just want to plug the Alzheimer's Association. They are coordinating a bus to go up to Madison for Advocacy Day. So if you were like, well, I don't want to drive to Madison, it's like, well, you don't have to. You could hop on the bus and you can get a ride there and back for Advocacy Day. They also provide always a lovely lunch. And really give you like a nice guide to guide you through that advocacy day. So if you want to learn more, you can always connect with us or the Alzheimer's Association to learn more about Advocacy Day. It's really, really fun. So if you're kind of considering it, I would highly encourage you to go, and we'll help you make that happen.
Thank you, Candace. And I see a question in the chat. Will you be sharing the recording of today's meeting with attendees? And Emily's put, yes, we will post it on our YouTube channel. Perfect. Thank you. Go ahead, Kayla.
Oh, yeah, I think Angie might have been speaking, but it was muted, so we couldn't hear you. So Angie, go ahead if you have a question.
The story of my life, always on mute. Is there an easy document that you can share out to this group, or maybe it's already on the website? I have quite a few family members that don't believe in dementia, don't believe Alzheimer's. They think it's just a part of aging. And how can you explain that to others that are around you when it comes to caring for a loved one with these symptoms?
If I may, I have a couple of really good resources for that. There is like a really nice site with the advocacy or the Alzheimer's Society that kind of guides you through like, how do I talk about this with my loved ones? Like legit nice talking points and ideas on how you can start the conversation, planning it, and things to talk about. That is a great one, and we can maybe I can try to find it quick and maybe put it in the chat, or maybe we can send it out with like the PowerPoint slides or something like that. Also the Alzheimer's Association has a really nice document about the warning signs. And the one that I really like to use, it tells you what the warning sign is. It gives you some examples of what that could look like in someone. And then it also compares it to what's typical with normal aging. So people know the difference between the normal changes that happen as we get older to everybody, and then the not normal things. Okay, something's going on here. This isn't a normal part of aging. So those are the two things that I usually like to start with. I can try to put them in the chat before we end. Otherwise, we'll send them out with the slides.
Yeah, we can definitely send them out with the slides no matter what, so that people who registered but couldn't attend will receive them as well.
I did have a question.
Oh, go ahead.
It's really quick at the end. My dad had Alzheimer's, dementia, and his doctor really was not supportive of medication or medical intervention. So we really didn't pursue that. I was just wondering about a resource to help families better understand the medications that are out there and the progress that's being made in terms of addressing dementia and Alzheimer's. Is there any kind of trusted resources that you'd recommend for that?
If I may again, yes, there is. So the Alzheimer's Association has a really nice place on their website that lists the different types of common treatments for symptoms and treatments for the disease itself, the pathology of the diseases. So it kind of breaks down like what are these different types of medications, what do they actually do, what are they used for, common ones that doctors can prescribe. So like the ones that have been around for a long time, the oral medications, like Exelon, why am I blanking on like some of the other ones, but they're the ones that are given orally to people to kind of help their brain work better, help get those messages through the neurons in our brain, help get that actually through to help our brain actually communicate with itself a little bit better. Those are common ones to help treat symptoms of the disease. And then there's the newer medications that are given through an IV. They are amyloid addressing medications that actually help clear out the amyloid in the brain that builds up. So it kind of helps to slow down the disease progression. So it's the first treatment that's actually doing something to treat the pathology of the disease itself. And there's been even strides within that area because it used to not be covered by insurance. Now it is. You used to have to go into a clinic to get this IV. Now they're working on things that you can actually give at home. That's kind of like an insulin pen that you put it in your leg and you can actually give these medications at home now. Their site goes through all of this information. You can print it out. You can send it to providers to even help educate them on what's out there now. Donanemab is a common one, and lenanemab right now. Aducanumab isn't really used anymore, and those are the IV treatments.
Thank you so much. And thank you, ladies. This has been really great. Lots of really excellent information.
Thank you. Thank you so much, everyone. All right, we are close to time, so we just wanted to thank you all for being here today. Thank you for sharing your stories. Special thank you to Senator Johnson for joining us today. Also, if there is any information that you need from us or need to connect with us, Emily will send out the PowerPoint and any other resource that we talked about today. With that, is there anything else, Emily, Kayla, Candace, that we need to touch on?
I just wanted to thank Virginia Zerpa, put some information in the chat and just wanted to shout out that she is another fantastic provider in the community and is part of our Alzheimer's Association office here in Milwaukee area. So just a note that, again, you're not alone on this journey. There are great resources to support you. Please connect with us and connect with the other great resources like Alzheimer's Association for the support that you need and deserve on your journey.
Yeah, thank you all for joining us today. Like I said, we will be sending out the presentation slides, additional resources, and the recording of the presentation shortly by the end of this week. So please be on the lookout for that. And if you have any questions, my contact information will be available after sending that out. But if you're looking to connect with either Christina, Kayla, or Candace, we can provide you that information as well when we send out that recording and everything. So thank you all for being here and hope you have a great rest of your week. Thank you.
Thank you, everyone.
Thank you.